Don't ask me why, but every so often I'll get a post from someone saying, hey, I have a lot of symptoms. I've been seeing a doctor. I don't know what to do. And they'll try to garner public comment to then go ask their doctors for what else that they need. Now, I have a problem with people doing this. I get why they did do this, but I'll explain my point. Let's go over these symptoms to just share my point of view. Now, there's a lot of symptoms that the patient comments. I'm going to go over some of them. She mentions her heart rate jumping up, but doesn't say how high. She comments joints in her legs popping and cracking when walking with pain and has migraines, but also comments that they have iron deficiency. But then on top of that, what dose? How often are you taking it? How deficient is deficient? Random chest pains. Have you had testing? Have you had an echo? You mentioned a murmur. What does the murmur sound like? And then random symptoms like air hunger. Do you mean like shortness of breath, like asthma? Do you need a pulmonary function test? Like, what do you mean by that? Heat intolerance, is that a thyroid issue? Like, have you had thyroid testing in the past? Like, what do you mean by that? But these are only a handful and not a completely exhaustive list. Saying a bunch of almost random symptoms online to try to garner and try to find one diagnosis, especially when you're talking to people that are not medically trained, is dangerous. But of course, people love to be helpful. But the problem is, if you don't have that training, everyone's like, oh, that happens to me. You probably have it too. Here's one diagnosis, or here's two diagnoses. When in reality, there might be multiple things going on that without a physical exam and lab work that she's had in the past, that information is not useful. This could actually be spurning the patient away from actual medical help that she needs and hyper-focusing because a random on the internet told them so. Please, please, please be very careful sharing your information online. And please, please, please be careful if you do not have medical training to share your medical experience with someone else. Always refer them back to their doctor to say what they may need in the future. Don't get scammed. Take back your health.